You'd think that in 2025, getting access to modern medicines would be, well, standard. But here in New Zealand, we're trying to run a first world health system with a she'll be right medicines budget. When we think about medicines, we often think about the end result. A pill, an injection, a treatment that works. But behind every medicine is a massive journey that most of us never see. Creating medicines is an epic story of discovery, research, and science mastery where only the safest and most effective medicines make it through. On average, just one potential new medicine in every 5 to 10,000 makes it through development, and that's only after 10 to 15 years of testing, tweaking, and costs upwards of $4 billion. Basically, it's the Olympics of healthcare, and most medicines don't survive the heats. Even if a medicine survives that marathon, the New Zealand system has 2 more gates to get through. First, MedSafe checks if it's safe and effective. Then, Pharmac decides whether they have the budget to fund it. Spoiler alert, it might take a while, because Pharmac has a legally capped budget that hasn't kept up with population growth or inflation, and a medicines waiting list much longer than your nan's pharmacy receipt. Let's talk about access. Here's the kicker. Only 7% of new medicines released in the past decade are available and publicly funded in New Zealand, while the average for other OECD countries is 29%, meaning we're well behind. Canada funded 3 times as many medicines as us at 21%, our closest neighbour Australia funded 24%, the UK funded 48%, and even Mexico at 12% beats us in publicly funded access to new medicines. Why? Because for years New Zealand has underinvested in medicines. We spend just 5% of our health budget on medicines. To put that into perspective, Australia spends 15% of theirs. That's 3 times as much as us. Pharmac manages a growing pile of medicine funding applications, and eventually, some of these applications end up on one of 3 lists. The options for investment, or OFI list, a meds Pharmac would fund if they had the budget. We call it the waiting list, and unfortunately, the average length of time on this list is currently around 7 years. Then there's the only if cost neutral or cost savings list, aka the only if it saves money or doesn't cost extra list. And lastly, the recommended for decline list. The name is pretty self-explanatory. Across developed countries, spending on medicines usually makes up about 1.4% of a country's total economic output. That's what fancy pants economists call the GDP. In New Zealand, we spend just 0.4% of our GDP to publicly fund medicines, less than a third of the average. We're not actually a poor country, we're just choosing not to invest in medicines, and somehow that's become normal, even though we're falling well behind Aussie and other OECD countries. Access to medicines can be life-changing, and for some people, life-saving. But our system isn't keeping pace, and since more public funding was announced in 2024, the number of medicines on the OFI list hasn't really changed, and a staggering 3.8 million Kiwis would benefit if the whole waiting list was funded today. Basically, the waiting list is still stacked, and even though nearly half of the medicines on it are already considered standard of care globally, they're still not publicly funded here. New Zealand's current model focuses on saving money up front, not what those decisions cost patients, families, or the wider health system down the line. But if you do the math, investing in medicines now can actually save us money later by reducing hospital wait lists, easing pressure on services, and keeping more people well for longer. So why, when it comes to medicines access in NZ, does even meeting the average seem daring? After all, having average access to modern medicines shouldn't be a dare. But since we're here, let's dare to be average, New Zealand. Join the conversation.